about that is that I think a lot of people really understood it, and we're fine. And if we just skip right to the practice questions, the people who didn't understand it and are struggling are going to be completely lost, right? Because I understand what you're saying. Like, now this is probably, for me going through it, it's probably the 5th time you've heard it, right? I just think that it's important for some of the people that didn't do as well in anatomy, that were kind of lost, okay? I hope that's okay. I do have, if you look on the very last, like the last 4 slides that I did here, you know what, you'll see it. The last 3 or 4 slides are just practice questions. So practice, like acid-based questions. So I think that'll be helpful, because if you can get through those, then you're good to go. Okay, let's start off. I know that it's basic. If you want to, mute yourself and go have a cup of tea and come back for the practice questions, go for it. And then everyone else can listen if they need to. So really, really basic. Obviously, you have acids and bases in your body. They need to balance each other out in order to maintain homeostasis. So where do the acids come? I always want to know, like, where things come from. For me, it just helps. But the acids are coming from, they're like I think of them as leftovers from cell metabolism. So as everything's being metabolized, there's acids left over. And we've talked about some of the ways acids, oh no, sorry, that was last semester. You will talk about it, about how some of those acids are made. And then you have your bases that neutralize the acid, or they either promote the excretion of acids. So pH actually stands for power of hydrogen. That really helped me when I think it's the right, there's another, it could stand for something else as well, but that really helped me. Power of hydrogen. Then I could, figure out in my head, we're talking about hydrogen. We're talking about that positive hydrogen ion. That's what determines whether the solution is acidic or basic. The higher that hydrogen ion, the more acidic, or like the more the higher the presence of it in the blood, the more acidic. The less hydrogen you have, the more alkaline. So that's no problem, right there. It's expressed. So the reason it's expressed in it as a negative logarithm, just because of the way they calculated the formula, and it can be really, really frustrating and confusing for people, because an increase in hydrogen, which makes you acidic, would be a decrease in pH. And then a decrease in hydrogen is alkaline, and that gives you an increase in pH. So you can just memorize that if you want to, but just memorize, okay, H goes up, pH goes down, and that's fine. If that works for you, go for it. For me, I would never be able to remember that, so I want to understand what's happening. And so I just know that pH in my brain, it's opposite of what it should be. So pH going down means it's acidic, pH going up means it's alkaline. No problem there. Let me just move to the next slide. Oh, yeah, I like this. So it ranges from 1 to 14. 14 is the most basic you can have. 1 is the most acidic. 7 is neutral. You guys know that our blood pH is slightly acidic, so it's slightly alkaline. See? Okay, and it's 7.35 to 7.45. Sorry about the spelling error there. So how does that happen? So remember, we talked about how the body is mostly water, right? So it's H2O. You can see it right there on the slide. So you have H2O, and that, when you split that in half, so if one hydrogen atom breaks off of that, which it does, you end up with this one hydrogen atom, and then you have, I can't remember what that is. If anybody knows, let me know. I think it's hydroxide. No, this is an HCO3. Hydroxide. Yes, thank you. Sure. So you've got it broken down, and you can see, just for people, I know this is probably repeat for some people, but you can see what's happening, right? You have 2 hydrogen atoms here, and one of them is splitting off here into this hydrogen ion, and then what you have left is one hydrogen and one oxygen. And so you end up with a hydrogen ion and a hydroxide. Okay, and these are what we need to balance. If they're perfectly balanced, you have a neutral pH. And when we talk about the pH of the body, we're talking about the extracellular fluid, so the blood and the interstitium. Right? We're not talking about cell. We're just talking about the fluids. And yes, it's slightly alkaline at 7.35, 7.45. You guys will understand then that if you go less than 7.35, it's acidosis. More than 7.45 is alkalosis. I know this is repeat for some of you. So the body's metabolic process, all of the processes are constantly kind of spitting out hydrogen ions and other acids. It's mostly from like carb and fat metabolism, so you end up with lactic acid, keto acids, sulfuric acid, amino acids, what have you. Those have to be neutralized and or excreted. So as part of the process, they also release, like as part of that, metabolic process, it releases CO2 as well. Okay, so no problem. CO2 is not acidic on its own, but it kind of helps if you think of CO2 as acidic. If you're struggling with understanding what's going on, I found that with some of my friends when we were going through, like reviewing all the material, they just felt it easier to think of PaCO2 as acidic. It just helped them. So you can do that in your mind, but just remember that it's not really acidic. It only becomes acidic when it meets up. Here you can see it meets up with, it meets up with a water molecule. You've got carbon dioxide, and then it kind of rearranges itself, and you can see the same way we did this before. It rearranges itself into two hydrogens, and it's basically carbonic acid, okay? And that's nice because it has acid in the title, so we know that it's acidic, okay? So how do we neutralize these acids that are left in the body? They have all these systems, right? The three main systems. You have your buffer system, respiratory system, and the renal system. And you probably want to know that for an exam like that, the buffer system is immediate, kicks in right away. The respiratory system takes a little bit more time, 2 to 3 seconds. The two textbooks kind of don't jive on this. They actually are. Anyway, just go with what was in the module. The module said respiratory system takes 2 to 3 seconds. The renal system takes minutes to hours to days. She's going to go with that. We'll go through each of them, so it doesn't. Don't have to know it like right now. So we're talking about the like chemical buffer systems. We're really talking about that carbonic acid buffer system, because the phosphate buffer system, so these are let me start. You've got 3 chemical buffer systems. You've got the carbonic acid bicarb buffer system, phosphate system, protein buffer system. Okay, those are your chemical buffer systems. Phosphate and protein really don't have a whole lot to do with balancing acids and bases because there isn't a whole lot of phosphate and in the extracellular fluid, and that's what we're trying to balance, right? So really, really, really focus on this carbonic acid bicarb buffer system. It's like a tongue twister saying that out loud. Anyway, so we'll go through. Let's talk about. I think I have. Oh, these stupid slides get kicked out every time. So really, when we're talking about the chemical buffer system, this is where most of your questions will be. There might be a question that's asking you like, what does the phosphate buffer system do? But it's very generic. It's very, like, there's very little information on it anyway, so it's easy to answer, I think. So this one, there are high levels of bicarb in the extracellular spaces, so in the blood and the interstitium. And what it does is it takes very, very strong acids and very, very strong bases, and it rearranges them. And like, I know some of you have taken chemistry or organic chemistry, so you'll know like how that happens, but it doesn't matter for us. We just kind of think of it as it's rearranging them to turn them into less strong acids or bases. So if you look here, I'm sorry, this slide got a little bit like kind of messed up here, but it's actually it's capital H, capital C, L. So it's hydrochloric acid, which is a really, really strong acid. And then sodium bicarb, which is a really, really strong base. So those two are, let's say those two are in the system, right? The body is going to neutralize those or rearrange those so that you end up with, you have sodium chloride here, and then you have your bicarb. Sorry. Yeah, your bicarb. I get really confused with all these numbers too. So it's just like making sure you're doing it right. And I do believe on most of the tests, they will use, like, they might put H2CO3, but they'll also put bicarb in brackets. So don't like super stressed about hi Karen, if you have any like, you know, oh, actually Karen, you'll probably know that. Did you have to memorize, like, for people who didn't take organic chemistry and like know all of these processes, you have to know that like H2CO3 was bicarb?
No, you don't need to know that. That's yeah, I haven't seen a question like that. Perfect. In the exam. So
good. I think it's just here so you can understand what's happening in the body, right? And it helps you to remember this is what's going on, so that, like I said before, if you understand the process, then you'll be able to answer the question. You don't have to just memorize what's happening. So I'm sorry that I said H2CO3 was bicarb, and I'm stupid. The H2CO3 is carbonic acid, okay? So now we end up with, right, we've broken down these really strong acids and really strong bases. They've neutralized each other, and we've come up with sodium chloride, and this is carbonic acid. Really, really important. I shouldn't have said bicarb. Just read that wrong. And then now you've got that sodium chloride and your carbonic acid, and that's going to then break down into, or rearrange itself into, well, really, this just goes off into your system, right? And the carbonic acid can then break down into water and CO2, and then the CO2 can be blown off through the respiratory system. So I guess it is a lot, I guess, if that makes sense, right? I hope. If you have any questions about that, let me know. I don't think I explained it really well, but if you have questions, ask now, because I'm going to go forward. The only thing that I think might come up on a test in terms of this is this 20-to-1 ratio of base to acid. So that's what the body wants to maintain. That's all. So this phosphate buffering system, like I said, it's not huge. Sorry, my slides got all messed up. They were beautiful. It's basically, I'm guessing you won't have a lot of questions on this. What you might have is one question on like what does it do, right? So it's taking, if you look here, this is monosodium phosphate. This is disodium phosphate, right? It combines with a bunch of other stuff in the body, molecules, and it just breaks down the strong acids and bases. So really all you need to know is that you have that monosodium phosphate, disodium phosphate, and that they break down strong acids and bases. Again, it's not really as important in terms of acid-base balance because there's so little phosphate in the extracellular fluid. And then the protein buffer system, all you need to know from your molecule or from your module is that it binds to the acid in the blood, changes the chemical makeup, and then so before it can alter the pH. So that's nice, because that could be a really easy question if that's all you have to remember. Look what they did. I've never seen it do this to me before, but you guys aren't seeing arrows there, eh? You're just seeing like these weird blocky things. Look at this scream. So let's talk about the respiratory system. The respiratory system is what is controlling that CO2. We talked earlier about what happens when we have high CO2. We have high CO2, it's going to combine with the water and create more carbonic acid. So the more CO2 you have in your system, the more acidic you will, your extracellular fluid will be, and your pH will go down. Okay, so more CO2 is more acidic. And the respiratory system all it can do is control that CO2. It's the only thing it can do to balance out what's happening in the body. So it can either increase respirations in order to blow off as much CO2 as you can. So when you hyperventilate, you're in, you're out, in, out, in, out. You're actually taking in more oxygen and releasing more carbon dioxide. So you increase respirations. You blow off all that CO2, which then there isn't enough CO2 in the system to combine with the water to make carbonic acid, and then you have a less acidic environment, right? And the opposite is also true. If you hypoventilate, you're breathing slowly, you're not getting in as much oxygen, but you're also not pushing out as much carbon dioxide. And that carbon dioxide actually can build up in your system, and it combines with water and creates carbonic acid. So you're going to end up with a more acidic. Did I say that right the first time? Oh man, a more acidic environment. Okay, so all you have to do with the respiratory system is think it through logically. If my CO2 or my PaCO2, when we get to the end of actual measurements, but if my CO2 is high, I built up CO2 in the body. That CO2 is going to turn into carbonic acid, and I'm going to have a high level of acid. And the opposite is also true. If I'm breathing slowly, I'm not blowing off enough I'm not blowing off enough carbon dioxide, and it builds up. Nope. My goodness. Let me start that again because I want to make sure that I'm doing them separately. I wish you could see the arrows. That's what's throwing me off here. A buildup of CO2 causes a higher acid level. The CO2 is then used to turn into. I know it's really hard. Yes, it lowers the pH, but it raises the acid. Yes, you're right. So you have all that increased respirations means increased carbon dioxide. Or sorry, you're blowing off the carbon dioxide, right? So you actually have less carbon dioxide in your system. And then that means you have less carbonic acid, less hydrogen, and then you have an increase in your pH, your alkalinic, right? All you have to do is follow it through. Even if I'm explaining it wrong, all you have to do is follow it through. You know that an increase in respirations means that you're going to have more oxygen coming in and more carbon dioxide going out. You're blowing off the carbon dioxide. And you follow that through. If we have less carbon dioxide, we have less carbonic acid, less hydrogen, which means we're alkaline, right? It's not acidic because we don't have as much acid that we're making. And that means let's say it's alkalosis. And yes, your pH goes up because of that negative logarithm they used, right? And then again, you can follow it through with the hypoventilation. You have low respirations, right? So the lines on CO2 should be switched. No. Can you see arrows there, Omar? Or are you just seeing like, all I see are these little boxes. I don't see any arrows.
Should I kind of like summarize it and write it down in the chat?
That would be good.
Okay.
I feel like I don't want to go over it 10 times, but then it's like, it's so tricky. It's tricky to say it out loud because you really get, I get mixed up in the middle of my sentence, right? Like it's just, it is complicated. Kieran's gonna, actually, Kieran, let me see if I can do this. Oh, it just comes off as boxes every time. Sorry.
Sorry if I get the spelling wrong. I'm really bad at that.
I don't think that matters at all. Nobody cares. But anyway, it really, really, really is just about knowing what's happening in the body. It's not about memorizing what's going up when this is going down, this is going up, and that's going down. You just have to think about, that an increase in carbon dioxide means an increase in carbonic acid. If you have more acid, you're more acidic, right? pH goes down. So you just have to remember that an increase in respirations or hyperventilation means that you're going to blow off more carbon dioxide and you're not going to have as much carbon dioxide in order to make that acid. And the opposite is also true. I don't know how to explain that any better. I think I summarized it okay, but let's go to the next one just so that this will help. Okay, so the same way that the respiratory system can only control carbon dioxide, the renal system only controls hydrogen, like the excretion of hydrogen ions and the reabsorption of bicarb. So the kidneys in their normal state, when they're healthy and they're working, they excrete hydrogen ions, right? And that, so if you're excreting hydrogen, you're losing acids, right? You're balancing out an acidic environment. Reabsorbing bicarb, right? That bicarb is alkaline. So that's the state that the kidneys are in normally. They're reabsorbing that bicarb, so making things more alkaline, and excreting hydrogen, which is also making things more alkaline. Okay, that's the natural state of it. It's not going to we'll talk about this in a minute, actually. Hang on. So anyway, if you have, I'm really mad at those. Acidosis, okay? How does that happen in terms of the kidney? Forget about the respirations because we're not talking about CO2 anymore. We're talking about bicarb. So if you have an increase in the reabsorption of bicarb in proximal tubule of the kidney, right? Then that's actually going to balance out that acidic environment, right? The kidneys can also generate new bicarb, and they can increase their excretion of hydrogen ions. So that's how they kind of respond to acidosis. And yeah.
Hopefully that's right, what I said.
See, it's hard. You think that it's nothing, but when you try to say it out loud, it does, or like write it down, get mixed up. I know. Like I know that I got really high marks on this, and I know that I understand it, but getting it across is actually not as easy as starting to understand.
For sure, the fluid and electrolytes was confusing.
I know.
So it's hard to wrap your head around it.
You'll say something, and then you go back and think, did I say that right? Because it is so confusing. But if you go through like this video and go through the module and write things down, make it make sense to you. Take what I'm saying, take what your prof is saying, take the notes, and make sure that it makes sense to you. However you need to make it make sense. This is how I make it make sense to me. So anyway, so we talked about, right, the respiratory system. It's going to deal with acidosis and alkalosis through CO2. Renal systems is all about the bicarb and the hydrogen, right? So in alkalosis, it can actually excrete. So that doesn't actually happen a whole lot. I know that the module said this, but it's really not common for the kidney to excrete bicarb. It's just not what it naturally does, right? And so you'll see when we talk about respiratory alkalosis that it's really rare for it to be compensated because the kidney is just not made to excrete bicarb. It just doesn't. Yeah, but it can also decrease its excretion of hydrogen ions, that helps, right? Because we're keep holding in those acidic hydrogen ions, and then it can increase ammonia production. So if you have, Samira, if you have alkalosis, so your body is too basic, your kidneys theoretically should respond by excreting bicarb. You want to get rid of bicarb because bicarb is alkaline, right? It's not really actually good at doing that. So it's really, really hard for it to compensate for respiratory alkalosis, but it does increase the excretion of these hydrogen ions, and that helps, right? One of the other big things it does is it increases ammonia production. So ammonia, you add the hydrogen ions, which is great. We don't want hydrogen ions floating around. It's making us more acidic. If you take ammonia and you add a hydrogen ion, it basically combines into something completely different. It's ammonium. And ammonium cannot be, it can't go back. It can't be reabsorbed. It has to be flushed out in the urine, right? So these two things are kind of working together to get rid of as much hydrogen, which is as acidic, as possible. We're going to go over this again. I just want to quick. So how does it, there was a chunk on how it creates new bicarb. So you have, you have water, right? There is an enzyme, carbonic anhydrase, that is already in the body. And what it does is it breaks that water down, we saw it before, into that hydrogen and hydroxide, okay? Then the hydrogen, it's hard because the arrows are gone. I'm so sorry, you guys. Okay, so you end up with hydrogen and hydroxide, right? That makes sense? The hydrogen goes off on its own. It probably joins the ammonia, right, to become ammonium. And then the hydroxide combines with carbon dioxide to create more bicarb. So I think for like a test question, understanding that like what's needed for the kidneys to actually create new bicarb, right? So you have carbonic anhydrase, which is always an enzyme, right? That's breaking up the water, separating it into hydrogen ions and hydroxide. And then that hydroxide is really what's important there in the creation of the new bicarb, because that hydroxide is what binds with carbon dioxide to create HCO3, which is your bicarb. And you can see if the slide turned out properly, you'd be able to see it a lot better, how it's breaking down. That you can see we've broken these down, right? We've broken down our water. So this, right, is going to add to the CO2 to make HCO3, which is new bicarb. And this hydrogen ion that's left over can also join other bicarbs and can break back down into water and CO2, and then the CO2 can be blown off, right? We want to blow off CO2. And again, we talked about the ammonia, right? Ammonia here is creating more ammonia. Ammonia attaches to the hydrogen, and that hydrogen can be from here, right? It can be from anywhere. And then it attaches and creates ammonium, and ammonium is just really difficult to reabsorb in the distal tubule, and so it gets excreted in the urine. That makes sense to everyone, right? Before I move on. Yes, okay. I missed you guys last week when I was recording because I wasn't able to say, like, okay, does that make sense? And then have, right? So let's go with 11. Okay. So we've already talked about this, right? We classify a high pH and a low pH as alkalosis and acidosis. And then we also use whatever is causing it. So if it's caused by the respiratory system, it's respiratory acidosis, and so on. Either of them can be a problem with either the respiratory system or the metabolic process, but it can also be both at the same time. And those questions do get a little bit confused, and that's why it's better to understand than memorize. So you've got your 4 basic kinds. I've listed them there. This would be so beautiful it turned out, but I tried to put everything that was related to acidosis in red and everything that was related to alkalosis in blue. So if you go back to the other slides, right, you'll see, like, hopefully that'll help a bit, right? Just so you get in your head that hydrogen means acid, bicarb means base. Okay, so one of the really important concepts that I do find people struggle with, if the problem is in the respiratory system. So if you have respiratory acidosis or respiratory alkalosis, that respiratory system can't compensate. So because it's the problem in the respiratory system, so it's not going to be able to blow off CO2 or hold in CO2, right? So it's the renal system that's going to kick in to try to balance that by either reabsorbing or creating bicarb or not. And again, and the opposite is also true. So if the problem is renal, then the renal system can't compensate. The respiratory system has to kick in with the CO2. When you get these questions, just try to pay attention also to the story. So sometimes they'll give you the numbers, and that's great. And you should most of the time be able to figure out which classification it is just with the numbers. But often there's a lot of hints in the question, like the patient hit their head and they're hyperventilating, right? Or if they're diabetic and they come in with these numbers, right? You're going to know if they're diabetic, most likely we're talking about metabolic acidosis or alcohol. Well, it's acidosis, right? So it gives you kind of hints in case you can't figure out the numbers. I just find that helpful. Okay, let's look what's here. Okay, so all of these are really easy to figure out. Don't panic when you see these, because I remember going through this and be like, how am I going to memorize all of these things? But they actually just make sense, right? If somebody's hypoventilating, we talked about this earlier, somebody's hypoventilating, they are not bringing in as much oxygen and not blowing off as much carbon dioxide. And so that carbon dioxide is building up, right? Carbon dioxide builds up, turns into carbonic acid, and you end up with acidosis. And it's because it started with hypoventilation, which is also related to COPD, also has hypoventilation or increase in CO2. Because it started with something respiratory, it's respiratory, right? The same happens a sedative overdose, because sedative or opioids are going to decrease respirations, or in other words, cause hypoventilation, right? Chest wall abnormality, you can't fully take a breath, right? Pneumonia, atelectasis, same thing. And then this Guillain-Barré, I mean, you just have to kind of remember that Guillain-Barré, it's almost like MS in terms of like your muscle strength and stuff. So you're just not able to move your accessory muscles enough to take a deep breath. But all this kind of makes sense. It's not rocket science, right? And then when you go over to metabolic acidosis, again, it makes sense. This is about breaking down lipids because there isn't enough glucose, and we're breaking down lipids in order to glucose in the cells. You have tons in your blood, but it's not in the cells, right? So you're breaking down lipids to get energy or ATP, and then you end up with these keto acids building up, right? Same with lactic acids. Starvation is for the same reason. You've got your body breaking down and creating lactic acid and all kinds of severe diarrhea. So this is how I make this make sense. Severe, like watery. Actually, I don't know. Does anybody know how to make sense of that? Severe diarrhea. So you're losing fluids. You're losing. Oh, there's bicarb. There's a level of bicarb in the intestines, and so if you get severe diarrhea, it can blow off can lower your bicarb. So it's not increasing your acid, it's lowering your bicarb. Renal failure, that just makes sense, right? Because your body is supposed to be reabsorbing bicarb. If the kidneys aren't working, it's not reabsorbing bicarb, it's not excreting hydrogen. So the hydrogen is building up and the bicarb is being excreted, and so you're going to end up with acidosis. I have no idea about how to make that make sense. This one makes sense, but we'll talk about it later. Okay. So again, you've got all of these. I'm not going to go through them again. You can make them make sense. They're not, you don't have to memorize them. They make sense for the most part. There's a couple you might have to memorize because I just couldn't make sense of them. But the rest of them, if I could make it make sense in my head, I didn't have to memorize. Alkalosis, just anything that's going to remove acids from the stomach, right? You have tons and tons of acids in the stomach. Anything that's going to remove that, so severe vomiting or GI suctioning, will can put the patient at risk for alkalosis. I do have explanations for these coming up in some other slides, so I'm just gonna go forward. Sorry. Okay, how are we doing? I'm like, my brain is fried right now. So let's talk about the four different things. Okay, respiratory acidosis. You're going to have a low pH. Okay, you're going to have a low pH, right? Because it's acidosis. It's caused by low CO2, which leads to low carbonic acid, right? If you I think this is how the body. It's hard without these arrows. Body. I'm just going to talk it through without looking at the slide because it's just really, without those things, it's really confusing. So you have
yeah. Sorry.
But no, please.
So the acidosis, is it low CO2 or is it high CO2?
So acidosis is going to be high CO2.
Okay.
I say low.
I think so. That's what I was kind of. Yep. Yeah, it's hard without the arrows, but yeah, that's why I just wanted to make sure.
Yeah, and I have to I think I'm going to stop looking at the slides because I'm just reading it. It's not making sense. I just have to talk it through, I think. But please keep catching me, please, because it's really hard.
No problem.
Okay, so you have a low pH, you have respiratory acidosis. Anytime you have respiratory acidosis, it's because you've had an increase in CO2 in your body. Your body is building up CO2. And so if you're building up that CO2, how is that happening? You guys can figure that out. It's usually hypoventilation, right? Or COPD. COPD patients build up CO2. The more carbonic acid you have, the more CO2 you have, the more carbonic acid you have, and the more acidic your blood becomes. It's that simple. The compensatory mechanism, so what happens? Well, the respiratory system can't start, so high CO2, sorry, Ashley. So high CO2 equals low pH equals carbonic acid. Yeah, but I wouldn't say it that way. That's I think it's a little bit more confusing that way because it's the high CO2 that causes the high carbonic acid. So it kind of goes in the other order, Ashley. High CO2 equals high carbonic acid, which then equals low CO2. Hopefully that makes sense. And then, so like, sorry, I was going into how the body compensates. So the body is going to compensate for that acidosis. There's too much acid, but it can't do that by blowing off CO2 because the problem is already with the respiratory system. So the kidneys are going to kick in and they're going to do their thing. Now, their natural thing is to reabsorb bicarb and get rid of hydrogen. So that's perfect because we have too much acid. We need more bicarb in our system. So the kidneys are going to give us more bicarb and try to get rid of some of that acid by excreting the hydrogen ions. So again, this is really understanding like these slides for the test. This is what, if you can understand this is making this, and how do I compensate for it by doing this, then you'll be able to answer any of those, like the number questions, like the ABG interpretations. Respiratory alkalosis. So now we have a high pH. Okay, so you get your test back, patient has a high pH, what's going on? They have, so Kieran, stick with me here so that I don't mess it up. So we're talking respiratory, which means that the carbonic acid, carbon dioxide is lower. They're blowing off too much carbon dioxide. So we don't have enough carbon dioxide in the system to create more carbonic acid. And so the carbonic acid starts to decrease in the system. And this can happen, yes, hyperventilation obviously is what causes it, but it can be caused by anxiety. It does happen more often with mechanical vented patients. And then, so what's the body going to do? Well, it can't increase the CO2 because the respiratory system is already not functioning properly. So the kidneys are going to kick in, okay? But this is what we were talking about before. So we talked about how the kidney's natural job, like what it does, is it reabsorbs bicarb, which is base bicarb, right? And excretes hydrogen, which is acidic. The kidneys don't really work great to do the opposite. They can't purposefully excrete bicarb, but they may slow that down. They can slow down their reabsorption, right? So this does happen, but it's a very late, very uncommon compensatory mechanism. I don't see that. Actually, I don't think I've seen a lot of respiratory alkalosis, to be honest. Okay. So metabolic acidosis, we're talking about a low pH, right? Acidosis, low pH. And how do we get a low pH or too much acid? There's either we've had an increase in the creation of acids, like we talked about before with the lactic acid and the keto acids, or we have a decrease in bicarb. So, for example, if the body's breaking up lipids for energy, it creates, there's a list right there on the slide, acetone, whatever acid, just acids. So you've got a buildup of acid now. If we're talking about a decrease in bicarb, remember we said the kidneys normally reabsorb bicarb. If you have kidney failure, if your kidneys are not working, right, your body won't be able to reabsorb that bicarb like it's supposed to and excrete that hydrogen. And so the hydrogen's going to build up and the bicarb isn't coming in to balance it out. And so you're going to end up with acidosis, even though it's like a lowering of bicarb, right? Hopefully that makes sense. Here's the thing about shock that I was talking about earlier. any kind of shock or hypoxia, right? You're not getting as much. It's an impairment of your CO2 and O2 exchange, and then you end up with basically lactic acid formation from you. And yeah, I'm not going to go through. I guess I can't see the arrows. I can't even. Let me make it make sense. Sorry, just one sec. Yeah, so your CO2 and your O2 exchange is compromised. So you end up with less oxygen, more CO2, which makes carbonic acid, and you end up with lactate formation. Okay, so see, if you just, it really is just about following it through, like reading it and going, okay, well, what would happen if that happened? What would happen if that happened? And just kind of keep going. And then you've got metabolic acidosis here, right? So your metabolic system can't compensate, but your respiratory system can. So anytime you have a metabolic problem, it's your respiratory system that's going to compensate. And it does this by, oh, Karen, it does this by acidosis. So we want, so here's how I work in my head. We have acidosis. So we want to get rid of as much carbon dioxide as we can in order to lower that. And so we're going to hyperventilate to try to blow off that CO2. And you end up with that rapid deep breathing and the Kussmaul that you get in diabetic ketoacidosis all the time.
That for sure is going to be on the exam. I remember that question. So
yes.
Just remember, yeah, that deep breathing, Cosmos, that word, Cosmos breathing. Whenever you see like special words like that, you guys need to pay attention to those because they're for sure going to ask that.
And they're not going to say Kussmaul and then put in brackets rapid deep breathing. Yeah. You're just going to have to know that that's what Kussmaul is. And once you know that, then you can follow it through. Like, well, what will happen if I do rapid deep breathing? Well, that's hyperventilating. So blah, 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 blah. You follow it along from there. Whew. Okay. I think we only have one left. Alkalosis. So, alkalosis, we've got an increase in pH, right? So we can have an increase in base bicarb or a loss of acid. We talked earlier about how that can happen with GI suctioning, right? So you're suctioning the stomach and the duodenum where all your acid levels are high. You're pulling out acid. Same with prolonged vomiting. You're removing acid from the system. Hypokalemia, we'll talk about on the next slide. That's probably, I'm guessing, a really important concept to understand. Hyperaldosteronism. Again, you guys didn't do that. We'll do this in the kidney thing, but aldosterone basically signals the kidneys to increase their sodium and water retention and decrease their urine output. And all it is that because you don't have so much urine output, your bicarb is building. It builds up. It's not like, I doubt they'll ask you anything on hyperaldosteronism, Karen, do you think?
No. Yeah, they won't.
Something nice to understand. I know it's hard to pick that stuff out, but the hypokalemia will be really important, I'm guessing. Anyway, if you've got metabolic alkalosis, your pH is too high, your metabolic system can't compensate, so your respiratory system is going to compensate. It wants more acid in the body. So what's it going to do? It's going to try to build up CO2. So it's going to slow down the breathing. So you're going to hypoventilate so that you're not blowing off all that CO2. Now you use that CO2 to combine with water and create carbonic acid. And that raises the acid level and decreases your pH. See, it's just got to walk it through slowly. It's going too fast earlier. Okay, so remember how when we were talking in the water, the fluid electrolytes, how sodium and potassium kind of move in opposition to each other? Just think of potassium and hydrogen as having a really similar relationship. So if potassium has come out of the cell for some reason, hydrogen is going to go into the cell, and vice versa, right? So in alkalosis, you've got a decrease in hydrogen. Hydrogen is what causes acid, right? Hydrogen is is what we're using to measure acid basically in your pH. But you have less acid in the blood in the extracellular space, right? So the body's going to pull hydrogen out of the cell to try to balance out that pH in the extracellular space. Because the hydrogen comes out of the cell, your potassium will go into the cell, and that makes the serum potassium low, right? So you end up with hypokalemia. And the same works opposite. So if you have hypokalemia for some other reason, for example, you're on diuretics and you're not taking potassium supplements, the same thing is happening, right? It just happens in reverse. So the hydrogen's actually gonna build up in the blood. Did that make sense? God, this is hard.
I think so. To me, yeah. But hopefully everyone else.
Okay. Yeah, Michelle. Okay. Oh, this base success. This is pretty easy. I'm guessing you'll have at least just one question. Base success is basically just a measurement of the amount of acid or base that's needed to return to a normal like pH. Okay. So if I'm just going to get over here so that I can draw. If normal is here, right? That's what your book says, right? If you have a score of 0.4 or +5 or +4, you have too much base, right? Because 0 or normal is talking about this is the normal base excess. Okay. So the further you here, it's the more base. The further you move this way, it's less base. No problem. That's pretty. So when you see +2 on an exam, it means you have a base excess. There's too much base. If you see, or maybe +3, because she's saying +2 is normal. If you're seeing -3, you have a base deficit. You don't have enough base. So it tells you two different things, right? It tells you whether you have too much or too little, which we just talked about. But it also tells you how much base needs to be added or taken away in order to reach that normal pH. Right? So if it's +4, you need 4 times or 4 equivalents of acid needed, right? So to balance that out. If it's -3, then you need 3 equivalents of bicarb or 3 less. Does that make sense? There's too much bicarb. Nope, that doesn't make sense. Hey, Kieran.
Yes.
Still there?
Yeah, sorry, I'm here.
It makes sense?
Yeah, I think it makes sense.
Okay. All right. Hopefully I didn't say that wrong.
I think it's coming together now. I think everyone, in the beginning, I think everyone's understanding it more now.
It's hard because there's just no way to explain it from the beginning that way.
Yeah,
You're going to be lost at the beginning. You have to go through the videos like 2 or 3 times in order to. Sure. If you stop now, if we went back up to the top now, you guys would be like, oh, yeah, that makes sense. But at first it was really like, oh. So manifestations, this really works for me to do it this way. So manifestations of acidosis, for the most part, are going to be the same, regardless if it's metabolic or respiratory. Okay, you've got the list here. You can memorize them, or you can go through and try to figure out why that's happening. It's pretty much common sense through here, right? Then you just have to look at what would be specific to metabolic acidosis and what would be specific to respiratory acidosis. So when we're talking about oh, sorry, here, let me explain this because I don't think this is clear. So when you have a low BP, right, your blood vessels are dilated. And again, it just goes back to that low, sluggish blood and the poor exchange between oxygen and carbon dioxide, right? So anyway, only metabolic. You will have hyperventilation in metabolic acidosis if the body is trying to compensate, right? You've got too much acid, so the body's trying to blow off as much carbon dioxide as it can to compensate for that. So you might see hyperventilation, but it is compensatory, right? And then these are the ones you'll only see if it's respiratory, and this makes sense, right? Seizures, hypoventilation. In this case, it's not compensatory. It's actually what's happening. It's the cause of the respiratory acidosis. Oh, I said that right there. And then VFib. I'm hoping you guys can guess right away what that's related to, because we just went through a whole slide of this, right? So your VFib is actually related to your hypokalemia. I have to really think about it. Let's move on. Same thing with alkalosis. So you guys can look through this, but I like really organizing it like this, where you see, okay, they're both this, and then only metabolic. These ones, Kieran, because I found these even when I wrote these tests, the symptoms of, like, say, low potassium, low chloride, whatever.
Yeah.
We didn't end up I ended up like understanding and memorizing them all, but we didn't have any questions that were like.
So with us, I did the same thing. Like, I was freaking out about the symptoms and stuff. But I think just knowing, because they will give you like application questions where they'll be like, oh, this person is coming in, they have these symptoms, and they give you a bunch of, okay, is this metabolic acidosis or whatever. So it's important to know it in terms of that, but just knowing like the main symptoms, like what speaks out to you the most. From like metabolic acidosis, what's one symptom that like is very important to know, or which is distinct, and that's the one they most likely will show you. So
what would you pick out of here?
So I think out of here, for respiratory, yeah. So for that, I think drowsiness, disorientation, all of those things, because I feel like that's important to know. For respiratory,
sorry, it's not too much different from alkalosis, right?
Yeah, exactly. Yeah. So
yeah.
So I think just knowing like just the main symptoms, you don't need to go crazy about it. It's a lot to know, so I wouldn't go crazy on it.
Awesome. So don't spend like 20 hours memorizing them like I did.
Exactly.
So such a waste of time.
Sorry, I just wanted to add something.
Yeah, go ahead.
So when I did it last week, I think there were only like a couple, like there were like 2 students here last week that I was talking to about this. We basically, a registered nurse RN on YouTube. For fluid and electrolyte, she has a bunch of videos, and she uses these acronyms for the symptoms, which is really good. So if you guys want to go, like, if you really want to know symptoms, and she'll like highlight the main ones. So yeah.
What's the nurse?
Registered nurse RN. That's her YouTube.
Okay, I'm gonna type that in. Like this, like just like that on YouTube.
Yep. Yeah.
Perfect. Yeah. Is that the cute little one with the accent?
Yes.
Yeah. I watched a lot of her videos. Yeah, she is. She's awesome. Clearly better. Anyway. So we're good with these, right? I do find that this comes up on tests a lot: irritability, nervousness. Yeah. This makes sense, right? You can read why right here. It just totally makes sense. And then hypoventilation it's compensatory here. Anytime you see hyper or hypoventilation in metabolic acidosis or alkalosis, it's a compensatory mechanism. Right? Again, seizures are always going to be respiratory. These things are too ambiguous to even bother memorizing, because you're going to have them with acidosis and alkalosis. And I'll tell you, like, in real life, they're very, very, the patients present in very, very similar ways, whether they have metabolic alkalosis or respiratory acidosis. They really just present in this very like decreased, like just sick, like they just feel sick. They're not so much saying like, oh, I'm really lightheaded, or I'm dizzy, or I'm sure some of them are throwing up, they're nauseous and throwing up. That does come a lot with both though. right? So I guess what I'm saying is they're not necessarily specific to one or the other. And Kieran's right, just kind of focus on these ones that are different, the ones that stand out so that you can recognize them when they come up on a test. That's all I would do. Yay, this is the fun stuff. Okay, these are the giveaway questions. Love them. So ABG, if you don't know, it's basically like an IV, but instead of going into the vein, it goes into the artery. So we have to put it in at a much sharper angle so that it goes in a little bit lower. And it gives you these 4 measurements, right? Your PaO2, your pH, your PCO2, and your HCO3. Your PaO2 is your partial pressure of oxygen. So think of it as like blood pressure, but for oxygen. It's giving you the pressure of the oxygen. Doesn't matter we need to understand that. That's what it is, right? It tells you basically how easily the oxygen is moving between the lungs and the blood. And the normal is 80 to 100. I'll tell you right now, for answering the like questions where they just give you an ABG and you have to interpret it, the PaO2 is negligible. You don't really need it. Just kind of slough it to the side. pH obviously is really important, but we already talked about it, right? It's 7.35 to 7.45. Your PaCO2 is really important because it's what's going to tell you how acidic, you know what? It's basically the partial pressure of carbon dioxide, right? So it's giving you information about the respiratory system. What's happening with the carbon dioxide? Is it high or is it low? And then you can figure out why. In a second, I'll show you how to do that. And then bicarb is just the amount of bicarb blood. But this is what's giving you information about metabolism. So when you're trying to figure out if it's respiratory or if it's metabolic, this is what you're looking at for metabolic. This is what you're looking at for respiratory, okay? And these 5 steps are so much easier than trying to memorize anything. If you can just understand it, don't even look at the slide, just listen to what I'm saying because the slide's all messed up with those arrows. So what you do is you look at the pH first. It's the first thing you do. And you decide if it's alkalosis or acidosis. So which side of normal is it on? Is it on 7, right? So even if it's within 7.35 and 7.45, if it's the middle of that is 7.4, right? So if it's on the lower end of 7.4, you would say acidosis. They're not acidotic, but it's on the acidotic side, right? Same with going above the pH. So kind of, because when you get to the ones that are partially compensated or compensated, that can get confusing. So use 7.4 kind of marker, whether it's above or below. So let's say you decide, okay, the pH is 7.49, so it's alkaline. Great. You write that down or stick it in your head or have it somewhere. It's the pH is alkalo. So you already know it's not acidosis, it's alkalosis. Perfect. Then you look at the PaCO2. The PaCO2 is telling you what's going on in the respiratory system. Determine if it's high or low, right? If it's alkaline or acidic. If it's high, right, your PaCO2 is high, that means you have high carbonic acid, which means you're acidic. If it's low, you have less CO2, which means you have less carbonic acid, which means it's alkaline. So what you do is you decide, let's say in this case, it's alkaline. You have low CO2. It's lower than it should be. You look back at your pH. Your pH is alkaline. If your PaCO2 is alkaline as well, that's your answer. It's respiratory acidosis, okay? Or sorry, alkalosis. See, it's so hard. Respiratory alkalosis. So what you're looking for is which of those sections, either the metabolic or the respiratory, which matches the pH. Okay, so if you looked at step 3, you're looking at bicarb now. Okay, so we had an alkalosis in terms of the pH. We had alkalosis for respiratory. Now let's look at the bicarb. Okay, we determine if that's high or that's low. If it's high, right, that means it's alkaline. If it's low, that means it's acidic. So let's say it's low. Okay, so you're going to compare that to the answer. Low, oh, that'll make it too complicated for you guys, I think. No, it won't. So low bicarb means acidic, right? So it's compensating. My God. The one that doesn't match, basically, okay, so it's not matching, right? You've got acidosis in your bicarb, right? You have low bicarb, which makes it acidotic, right? That doesn't match your pH. Your pH is alkaline. Your respiratory is alkaline. Your bicarb is acidotic. So the two that match is going to give you, that's going to give you like what it is, right? It's respiratory alkalosis. The one that's left over, that's going to tell you whether or not the body has compensated. Because remember we said if the problem is in the respiratory system, the renal system has to compensate for it. So you look at that one that's left over, and in this case, we have low bicarb, okay? And you ask yourself, is it normal? If it's normal, then the body hasn't done anything to try to compensate for that respiratory alkalosis. Right? It's not making any changes in terms of the bicarb to change that alkalosis, right? If it's sorry, I just want to make sure I'm not saying this wrong. I can do this better when I look at them. I think I have some here. Yeah, that's way easier to do it. So anyway, if it's it'll be easier to explain when we go through these practice questions, but partially compensated, so that's if it's high or it's low, it's not in the normal range. This is, and we're talking about the leftover one, the one that doesn't match, whether it's bicarb or respiratory. In this case, it's bicarb. The one that doesn't match, if it's high or low, but the pH is still outside of normal, right? It means the kidneys have tried to kick in, they've tried to compensate, they're decreasing the bicarb, which we said they couldn't do, but whatever. They're decreasing bicarb, increasing hydrogen ions, but it's not worked yet. The pH is still high. It's still alkaline. So that means it's partially compensated. It started to compensate, but it hasn't fully compensated yet. When you end up with a pH that is, say it's alkaline, like we have, and it's so the pH is high, but it's still within the normal range. So say it's 7.44, right? That's why I said at the beginning, you still have to kind of look at that 7.4 as the marker, because you still know it's higher than that. So it probably wasn't acidosis. It was probably alkalosis that's been compensated, right? So if you look at that, that third leftover there, and it's changed, it's gone high or low to compensate, right? Then you look at the pH, and if it's in the normal range, it means it's compensated fully, no problems. Hopefully does that make sense? We can go through these if you want, if it helps. I'm gonna go through. Let's do the first one. I'm just gonna do the first one, walk it through. You have a pH of 7.3. So first thing you're doing is asking yourself, is this acidotic or alkaline? Karen, you tell me, because I'm tired. Anyone? Oh, did she go? Anyway, it's acidotic, right? It's below 7.35, right? Good. Yay.
Sorry, acidotic. I muted myself. I was talking.
Yeah, I'm just teasing. I'm just like wanting someone else to talk. But anyway, your PaCO2 right here. I put the normals over here. You guys do have to memorize these. I didn't go through them because I assumed you know that. Right, it's acidic because it's high. So does that match this? Yes. Yay! So then what do we know that it is for sure? So this is representing the respiratory system. It's respiratory acidosis. Good. Now tell me if it's compensated. So you've got your bicarb, and it's high. Good. You got it. Partially compensated. Okay, so you guys are fine with these. What's the, okay, so let's go to the next one. actually, why don't you guys work through them and throw it up when you get it? Like, put it up on the chat when you get it, and we'll talk about it after.
I think these are my favorite part of this.
I know. But the thing, if you understand the rest of it, like this is really easy to do, right?
Yeah, for sure. I feel like it's kind of like a problem-solving game.
Yeah. I love these. Like when we had our test for this section, we had like a lot of these and a lot of isotonic, hypotonic, hypertonic solution questions.
Yeah.
So you just had to understand what the process of the body was, like what it's doing.
Yeah.
And you could get the answer no matter what. A lot of my friends tried to memorize things and they really screwed the poo. They just couldn't.
Yeah. With this, you can't really memorize because it's like it's really hard to.
You have to be able to understand it.
Yeah.
You got it, Lichelle. Right? Because your pH is low, so you're acidotic. CO2 is super hot. Wait,
is that the third one? Or no, that's the second one.
Second one, right? Let's go through it. Yeah. So what's this, Karen?
That is 7. That's low. Right?
It's low. So we're acidotic or alkaline?
Acidotic. That's acidotic.
Okay, good. So acidotic. What's this? High.
Are you pointing at the
Can you see what I'm doing?
Yeah.
Oh, well, that's not helpful. I'm drawing all over the slide. Okay, anyway, PaO2, is that even helpful? I don't care. I'm just going to skip over it. The piece, because it doesn't. It's not going to make any difference.
No, it's not very,
right?
No.
Your PaCO2 is 23. That's low, right? And it's low, which means your acid is low. So this is actually the opposite of this. This is alkaline. This is the opposite of that. So we know it's not that. This is low, so we know it's acidotic. So we have metabolic acidosis. And then your PaCO2 is 23. And what's the normal? Yeah. So it's low enough that it has partially compensated. Everybody gets that, right? Oh, yeah. Darla, be really careful when you're looking at these that you don't misread PaO2 as the PaCO2. They'll throw this PaO2 in, but it looks like, because you're used to just going pH, PCO2, HO, or bicarb, you might look at them and think, oh, respiratory.
That happened to me before, so please be careful.
Yeah. I actually, whenever I get these, I literally cross out the PaO2 before I do anything else. I just scratch it off. Like it's just going to be useless and throw me off. You guys want to do the next one? Yes. You guys can't see what I'm drawing? This whole time I've been filling in the arrows for you. Waste of time. All right, we've got a high pH. See, the only thing with drawing the arrows, Lachelle, is that a high pH, which is an arrow up, right, is, let's cross off this piece, AO2, who cares? If you have a high, so you're an up arrow for CO2, it actually is an increase in CO2. So your arrows match, but they're actually moving in the opposite direction. So this is where a lot of my friends got like messed up, because they memorized that, okay, if these two arrows are the same, it's this. If these two arrows are the same, it's this. You can do that. But it does get really, really confusing, I find, rather than, it's just so much easier to just understand what's happening in the body. If the pH and the HCO3 are going in the same direction, then it's metabolic acid. So if it's going in the same direction in terms of going towards acidosis or going towards alkalosis, then yes. But it's not about the arrows going in the same direction, right? Because an increase in here, so that might work for bicarb because they're both going up, right? If this is alkalosis and this is, but if you look at, let's say, am I making sense, Kieran?
No, I think you are. I think it's just
I hate that arrow one. I know they
yeah.
teach it that way, but I'm like, it doesn't make any sense. It's
Yeah,
just
I don't
more.
like the arrow one either. I think the one with the chart, the A and B, the with the neutral and that's how I
Yeah,
did.
yeah, and that's basically this. Like it's basically
Yeah.
walking through and thinking through what's happening, which one's acidotic, which one's alkalosis, and then matching them up. You can't go wrong if you do it that way. If you try to memorize the arrows, you may miss out on some of the like partially compensated or fully compensated ones. It can really mess you up.
Yeah.
Anyway, you guys do it whatever way works for you. When I'm at like in the hospital, I just do it logically. Like, see, it's hard to like go over all that stuff that we talked about earlier, but this is like, okay, you get this ABG back, you look at it, and right away, it's just boom, boom, boom. You know what it is, right? So pH is normal, and CO2 and HCO3 are abnormal. How would you know if it's metabolic or respiratory? You would know because which side of normal is the pH on. So it won't be, if it's 7.4, I don't know, I've never seen it come up like that. If it's 7.41 or 7.39, you know whether it's acidosis or alkalosis. And then you match up the CO2 and HCO3. Does that make sense? Okay. I do have some like that in here. Want to just keep going through these? I have time. I know most people have left, and that's fine. If you need to leave, go. But I actually find this the easiest part of everything we just went through. So 7.5. Acidotic or alkaline? Anyone? Alkaline. Perfect. So it's high. We have alkalosis. This is, you don't need this. Oh, you're not seeing my arrows. I'm going to stop drawing them. PaCO2, high or low?
In the middle. Oh, sorry. Sorry, I didn't mean to say that. I'm sorry.
No. It's normal. You got it. Normal. So that's probably compensatory there, right? But let's look at the bicarb. High or low? Which one are we even on? High. High, which means what? Is it alkaline or acidotic? Slow down, Michelle. It's okay. I'm just teasing you. So the bicarb is I'm on the wrong question. The bicarb is 34, which means it's high, which means it's alkaline, right? So this is, you got it, metabolic alkalosis. And then if the PCO2 hasn't changed at all, it's still within normal range. It's uncompensated. It hasn't done anything. Okay? You got it, Michelle. You got it super fast. Okay, let's do the fifth one here. So first thing we do is look at the pH, high or low. I don't want to walk you guys through. You guys just throw it out there when you get it. I have to think. Oof. That's an interesting one. You got it. Let's see. Are you guys using the arrow thing or are you walking through it? Good. Okay. We can do more. You guys are here. We might as well. So let's go to number 6. Okay. Anyone? So it might be a little tricky. Okay, does anyone have a guess yet? Close. Let's walk it through. What do we have here? Is this acidic or alkaline? It's neither, right? It's normal, but it's on the acidic side of 7.4. Right? Remember I told you to do. Yeah. So this is acidic. Okay. Your PaCO2 is 27, which is actually low, which means that's alkaline. That's confusing, right? Okay, so you have acidic here, alkaline here. Bicarb is 19, bicarb, which is very low, which means it's acidic, right? So you actually have metabolic acidosis that's fully compensated. Does that make sense for everyone? Because those are the ones people find really tricky, the fully compensated ones. Okay. Let me see here. Go to number 9. Try number 9. Anyone have a guess? Nope. I see where you get that from, but so go through the steps again, Lichelle, like one at a time. We're doing number 9, right, everybody? So Lichelle? Yeah, okay, yeah. Yeah, do number 9. Tell me what you think about that one. Don't look at Darla's answer. Does anyone else have a guess for number 9? Kieran, you should be able to do these super fast.
Yeah.
Yeah, but I can't.
She's like, I'm like, no.
All right, let's look it up. We'll break it down. Okay. So your pH is 7.35. Is that acidotic or alkaline? Or is it on the acidotic or alkaline side? It's normal, but it's on the acidotic side. Yes, you're right. All right, your PaCO2, is it high or low? It's high. What does that mean? Is it acidotic or is acidic, right? So right there, you know you have respiratory acidosis, for sure. And then you go over to the bicarb and see if it started to compensate yet. So the bicarb is high, which means it's trying to compensate. And it actually has. It has compensated because it's brought the pH level up to 3.5 from where it was. So you've got a fully compensated respiratory acidosis there. So go through the, if you go online and stuff, you can find tons of these practice questions to kind of, but I do like these word ones since we're all here. So Anne, who's drinking beer at a party, falls and hits her head on the ground. So right there you have a hint. Okay. Her friend Liza dials 911 because Anne is unconscious with depressed ventilation, shallow and slow respirations, a rapid heart rate, and she's profusely bleeding from both ears. This girl is in deep poop. Which primary acid-base balance is Anne at risk for if medical attention is not provided? So there's hints all over the place in here. Because Kieran, did you get a lot of these kinds?
There were some like that.
There were some like this, she just said.
Yes, and there were ABG questions with values.
You need to like look at this and make it make sense to yourself, right? Anytime you fall and hit your head, and it's going to, and then she's even saying respiratory, she's hypoventilating right here, right?
Yeah.
So I just want to make sure I got this right. So she's shallow and low breathing. What's going to happen? So you just walk it through. You know she's hypoventilating. So she's not blowing off as much carbon dioxide as she should be. So the carbon dioxide is building up in her system. When that happens, it makes carbonic acid, which means she's going to be acidotic, and it's caused by something in the respiratory system. So the answer to that is respiratory acidosis. Does that make sense to everybody? Yeah, it's respiratory acidosis. And there's a couple more like that on here, because I find these are the ones people struggle with too. You've got a 6-year-old boy who's rushed to the hospital following her, I don't know how that happened, but whatever, mother's complaint that her son has been vomiting, nauseated, and overall weakness. Okay, so right there, whenever I see that it started with vomiting and nausea, I'm thinking it's going to be metabolic. Exactly, Darla. But let's see. After a series of tests, the nurse notes that the laboratory results, potassium 2.9. So which primary acid-base balance the boy at risk for if medical intervention is not carried out? So think through the potassium too. Pretend you didn't see this. Well, it doesn't actually matter. He's got low potassium, so what's happening? Can anyone walk that through from before? This is what's going to do if it's alkaline or not, acidosis or alkalosis. Right, so yes, but no. Okay, let's walk it through. I want to make this make sense. You have low potassium. Why? It doesn't matter why. You have low potassium. So that means the potassium is moving into the cells. Hydrogen is moving out of the cell, right? So that makes sense to me. Metabolic acidosis. Does that make sense to everybody else? Okay. To the last one, and then we'll sign off. Kieran, would you mind sticking around for a minute? I just want to talk to you after.
Yeah, for sure.
Thank you. A company driver is found at the scene of an automobile accident in a state of emotional distress. He tells the paramedics that he feels dizzy, doesn't remember what happened to his car. His respiratory rate is 34 a minute, so that's high, right? Which primary acid-base disturbance is the young man at risk for if medical attention is not provided? So I'll let you guys figure this one out on your own. See, you guys are gonna do awesome. Super fast. If you want to do a couple more, there's a couple more there. Is anyone trying number 13? Yeah, Luchelle. I'll go back. So in this question here, wait, Darla, just hang on. In this question here, number 11, the potassium is low. And remember we said potassium and hydrogen are work in opposite, kind of the way that potassium and sodium do. So potassium is moving out of the cell, hydrogen is moving in, and vice versa. They go opposite of each other. So if you have a 2.9, that's low, right? It's hypokalemic. When you have a low potassium, what does that mean? It means your potassium, you know what? This question isn't very good because it could be two different things here. So on the one hand, you could have the potassium going into the cell, right? Which then pulls the hydrogen out. So that would mean that the extracellular space is going to be acidotic. Okay, but the potassium could also be a result of alkalosis, right? So it could be that, right, for acidosis. Let's say 3.5 to 5. This is very low, yeah. So, okay, let's think about the other way. What would cause the potassium to go into the cell? Yeah, there's no other way to think about that, right? That makes sense. Okay. Sometimes when I do, I kind of find myself like I'll go over the question again and just what I just did. Like, okay, no, and you walk it back the other way and it doesn't make sense. So Darla, you did 13, right? What did you say it was? Or somebody did it. Lichelle, that was you, maybe? 13. So you got partially compensated respiratory acidosis for 13. I don't have that, so let me look at what it is and see. So your pH is 7.55. It can't be acidosis. It has to be alkalosis, right? Because your pH is high. Don't get messed up with that. I know. That's why the arrows are stupid. Just it's alkalosis. Your PCO2 is high, so that's acidic. Your bicarb is high, so that's alkalosis. So you've got respiratory alkalosis that's partially compensated. It's not fully compensated because the pH hasn't gone back to normal, right? Yes, basic pH, Darla. You've got it. Might as well just do 14 and 15 and then we'll sign off. For those of you who are still here and want to do it. It's way more fun to do in person. I used to bring like chocolates and throw them at people and whoever got it first. Anyone? Oh, 14 is freaking hard. This is good for those of you who stuck around. You're gonna be something that this one's really confusing. Okay, so what's up with this guy? It's normal. I don't even know. I'm gonna walk through it. Let's walk through it. Sorry, this is what we're talking about. Oh, it's super acidic, right? So we know it's acidosis. It's definitely acidosis. What's bicarb is low? That matches, right? PCO2 is high. So all three of them are acidosis, right? 14. We're doing number 14. All three of them are acidotic. So if you ever see that where all three are the same like that, it means it's both. You have both respiratory and metabolic acidosis. And that does happen. I don't know if you'll get that's a little bit of a harder question. I don't know if you'll get one on the exam that's quite like that. But for the NCLEX, you should be able to know to understand that, recognize it. Okay. Does everyone understand how that is? Like why? Oh, okay. Yeah, I can repeat it. So your pH is low, which means you are acidotic. Definitely acidosis. So you write that down, acidosis. Just the CO2. That's probably supposed to say C, Darla, but good catch. You caught it this time. Sorry, 14 again. Let's go back for Lichelle and Samira. Okay, so the pH is low, it's acidotic. Okay, your bicarb is also low. If your bicarb is low, that's the base that balances out your acidosis. So this represents acidosis as well, right? So these two match. They're both acidosis. So immediately you would think, okay, it's metabolic acidosis. Then you go over to your PaCO2 and you see that it's high. And that throws you off because now you don't know if it's respiratory acidosis or metabolic acidosis. And the reality is that it's both. When you have all three of those are acidotic, it means something's happened, for example, a brain injury, where you have gone into both respiratory and metabolic acidosis at the same time, and there's nothing to compensate. So this is where we go in and pump in a ton of bicarb, like as much sodium bicarb as we can get into the patient, right? To try to balance that out. Does that make sense now? And if it doesn't, it's fine. I can explain it again. You won't, I doubt very much you'll have one. Is it, Darla? Everyone do the last one. I know. I just want other people to do it first. Yeah. Oh, she did. Lichelle did it. So yeah, it is normal. Just to throw you off. This one's normal. So you guys are gonna rock that. You're not gonna have any problems with that. I mean, you know what though? Like I had a prof that did that and threw a lot of people off because you don't want to pick normal out of the options, right? You left A, B, C, D. You don't want to pick normal. It can't be normal, but it is. Is there anything you guys want to go over? I have a little bit of time, so like if there's anything that I didn't explain well that you want explained again, let me know. There's 10 of you here. Nope, we're good. Okay, I'm gonna let you guys go then. Oh. Kieran?
So yeah, the questions are going to be similar to what Lauren like put out. For the written questions as well are like similar to ones that I saw on the exam for sure. So yeah, so just be prepared to know the values and know from there. So yeah, they're very similar to this.
If you look back up like 14, no.
No.
I figured by the time we got there, you guys would be old pros and you'd be like, what? And you did. You guys caught that there was something weird going on, right? Towards the beginning of what? Samira? You guys were talking about strong acids and bases. Do we have to know that equation? So you don't have to know, I don't think, Kieran, correct me if I'm wrong, you don't have to know any of these equations.
They're not going to ask you to know the equation. The only thing from there you should know is, yes, most likely, like the so just knowing the buffer system, how it functions, and just how it works. You don't need to know the.
Yeah. You might need to know, Samira, you might need to know how it works. So as opposed to like knowing this formula, you might have to know that how does the body balance out really strong acids and really strong with really strong bases, and you would just have to know that it does that by creating sodium and carbonic acid and blowing off the CO2, carbon dioxide. Like I would think that would be the closest you'd come to having to know, just how it breaks down. It's really easy. And I don't even think, Kieran, I can't imagine they would even make you.
No, they're not, no.
But that's the hardest thing about these classes is knowing like what tiny little thing are they going to ask, and what should I and that's why like when I go over this stuff, it's like let's understand what's actually happening in the body, because if you start memorizing stuff, you're just going to get lost.
I just have a question for the students. Who do you guys have as a prof for patho?
Charlene something?
Oh, okay. Sorry. I had Raj, so I didn't.
But it's the same, they'll use the same test. Like the test will be about the same.
What does it say? Kieran, do you suggest doing the practice questions from Sarah? Do you mean, yeah. It's the registered nurse RN, right? That's the one that you're talking about? She has really good questions, practice questions on her site.
Yeah, any practice questions that you can get.
For sure.
I think there's just Google like acid-based practice questions, and it'll come up with like a ton. And you can just practice them out. Okay, I'm gonna let you guys sign off. I just wanted to chat with Kieran, so I'm gonna wait till you guys all sign off, and then thank you. Thanks for sticking around, you guys. You're gonna do good. I think you're gonna do well. Those of you who, oh my god.